Hello and welcome to our presentation today on learning circles, bringing people together. This is part of our ongoing series of webinars about the NUCA system of care here at South Central Foundation. My name is Gil Prickett and I'll be your host for this session. Joining me today are our two presenters. KJ Warby, who is our Clinical Director of Learning Circles, who's been with South Central Foundation for 20 years, and Sandy Bowling, who's our Manager of Learning Circles in our Family Wellness Warriors Initiative, who's also been with South Central Foundation for 24 years. I'm the new kid on the block on the stage. I've only been here for 12 years. But without further ado, I'll turn it over to our presenters, and they're going to share with us all of their information and all of their knowledge about learning circles and how we use them in the NUCA system of care.
Hello everyone, my name is KJ, and as Gil said, I've been with SCF for nearly 21 years. I have a passion for learning circles, and I'm really delighted to be able to share this information with you. So in today's webinar, we're going to be looking at relationships and well-being, same-day access, how learning circles is a corporate-wide strategy, and what we're doing to show continuous improvement of our strategy. And our goal is always to focus on our customer and serve our customer owners as they need.
When I look at South Central Foundation's vision and mission statement, it's all about our vision for our Native community to have that physical, mental, emotional, and spiritual wellness. And I truly believe that that is what we do here at South Central Foundation through learning circles, not just our primary care center, our behavioral health services, but through all other departments that lead learning circles. When I look at physical, I immediately think about our health education department and all of the learning circles they have to offer for not only our customer owners, but for our employees, in that they offer the yoga, they offer TX training, strength building, and so forth. And I think of emotional and mental, I go immediately over to behavioral services with our learning circles that they offer. And then spiritual wellness, and again, the emotional, I look at Family Wellness Warriors Initiative and the learning circles that we offer through that department. So we are meeting, hopefully, the needs in various ways to our customer owners. So the mission statement also is a driving force here for us at SCF. It reminds us of why we're here and what we're striving to do for our Native community.
And I'm going to add just one point. I want to underline working together with the Native community, because you will see as this webinar goes that you'll start to understand how our providers and how we as people working at SCF absolutely work together with the Native community. So we're partnering with them through learning circles.
Correct. And the goals of South Central Foundation, when I look at shared responsibility, commitment to quality, and family wellness, I look at and think about, for myself personally as a customer owner of SCF, that I do have that say with my health care. It's not just my primary care provider telling me, I get a say. He listens to me. And I know that I have a responsibility in my health. So there again, if I need something, I can either go to my primary care provider, but maybe it's something I don't need there. I need it through a learning circle, and I have those available to me also. And we work together here at SCF with the whole family, not just the individual, to achieve wellness. And we're continuously striving to do the best, give the best services that we can give. And I believe that Learning Circles is just another piece of us giving back to the community and the quality of the services that we offer. South Central Foundation's healthcare system is customer owner driven. And much like the healthcare system, so are our learning circles. We bring people in to this listening to what they want. We did that through our gathering. We went to setting up tables at our primary care center, listening, getting what our customer owners wanted to do with learning circles. What were the topics? What were things that what were they wanting that they didn't necessarily need to be seen by a clinician for? Relationships here at South Central Foundation again it's the foundational piece that we operate from. Alaska Native American Indian people are all about family. They're about relationship. It's the family that comes first. And our ability to develop relationships with our customers is directly, it relates to our effectiveness to the care that we give. When I look at a couple of even the letters like relationship between our customer owners, family and provider, that relationship is formed in our learning circles. We form community there. We provide that place for them to talk and be safe.
So Sandy has just finished sharing about operational principles. And again, the word that we use that reflects our operational principles is relationship. And one of the ways that we really underline the importance of relationship at SCF is through a training called Core Concepts. This is a mandatory 3-day training. The president CEO is always at the training, and our at least one vice president is there for the full 3 days. And it is an opportunity to share story and show our staff how to share story. In Core Concepts, our president CEO, Catherine Gottlieb, will actually share some of her personal story. And in the audience, our staff have an opportunity to listen and respond to her. The whole idea around Core Concepts is to teach people how to enter into a deeper level of relationship. Because we believe here at SCF that relationship really is the crucible in which healing occurs. And the better relationships we have among us as staff and with our customer owners, we think that is the absolute path to wellness. So in Core Concepts, these are our core concepts that we try to engage in across our organization on a daily basis. Work together, and the acronym is wellness. Work together in relationship to learn and grow, encourage understanding, listen with an open mind and laugh, have humor throughout the day. Notice the dignity and value of ourselves and others, engage with others with compassion, share our stories and our hearts, strive to honor and respect ourselves and others. For me, those last 4 really start speaking to how important relationship is and the value of being willing to engage in relationship with our customer owners. So Core Concepts is a training that was actually birthed out of a program that SCF has called Family Wellness Warriors Initiative. FWWI is the only faith-based component of South Central Foundation. And it uses the same model that I mentioned at Core Concepts, where you have a speaker who shares story on a stage, and people are divided into small groups. They hear story, and then they go and they discuss how that story impacted them and how they connect to the story in their small group. It is a very intensive 5-day training. early morning to fairly late at night. And what it does is offer tools to help people understand their own story, to help people understand the impact that their childhood has had on them, or the events of their own lives have had on them, to understand how they engage in relationships with others because of that, and then also tools for understanding and changing relationship and improving relationship. The absolute goal of Family Wellness Warriors Initiative is to end domestic violence, child abuse, and child neglect in this generation. And so those are the topics, the type of topics that FWWI is addressing. Now, the power of this relationship, the power of being in a small group and sharing of yourself and sharing your heart and listening to other people share their hearts is tremendous. FWWI has been in operation since 1999, and we've got some great data that shows that relationship, which is what FWWI is doing. It's creating intentional small communities called learning circles to help people engage in relationships. So here's some of the results. Now, there's a pre-test before they do the training for our participants. There's a post-test immediately after the training at 6 months and then at 12 months. And when we look at the data, the results are really impressive. Participants show statistically significant increases in cultural connectedness, family cohesion, self-esteem and self-efficacy, a decrease in substance use, and a decrease in depression. We also know that this training increases participants' protective factors. To date, 11,000 people across the state of Alaska have attended a FWWI training, and we've taken FWWI and worked with communities across Alaska and also in Canada. So those learning circles from FWWI really have been a foundation for what we now have as a corporate-wide initiative and strategy to use a model like that and have it expand across the corporation. So as I was emphasizing that relationship and well-being is what we believe one of the key factors of learning circles is. I think I want to touch a little bit on the concept of a customer owner. I know Sandy mentioned it a few times earlier, and that may be different wording than you're used to in your own employment. For us, the folks who come in to see us are customer owners. They're not our patients, and they're not our clients. Customer owner has a very different feeling. Can you feel how that is? It implies some responsibility on the customer, but it also implies that we are partnering with a customer. We are not doing to. We are not the authorities telling people what to do. Customers have a lot of voice, and we use customer voice at South Central Foundation to drive a lot of the work that we do. So I'm going to link this to behavioral health services and the value of relationship. So I'm going to show that in behavioral health, there's a lot of evidence shows that the relationship is one of the biggest core components of treatment success. And so I'm going to connect that to, this is why we know that relationship is so, so powerful. So as a behavioral health therapist, I've been witness to an explosive growth of the number of behavioral health approaches and theories to treating behavioral health disorders. Since the time of Freud, an explosion of treatment models and approaches, 600% growth in psychotherapy approaches and different theories. Right now, today, we have more than 200 therapy models. I don't know how anyone could keep up with that. EMDR, DBT, MRT, cognitive behavioral, sensory motor. The key factor in all of those types of treatment is relationship. And we are seeing that more and more in the research that is being suggested to us as we spend more time looking at what really works in therapy. So when you look at all of those different treatment models, what we are starting to understand is that the models are actually approximately equal. If you look at these quotes, and these are different quotes from research that's out there, the traditional comparative studies that have pitted therapies against one another, for the most part, have shown no essential differences across modalities. This finding is amazingly consistent across rigorous and controlled studies. Now, we know that our provider-customer-owner relationship matters. If I don't have a good relationship with someone who's coming in to see me, I'm not going to be successful as a therapist. We know that therapeutic alliance is what makes a difference in behavioral health care. It's also what makes a difference in medical care. Again, that relationship is the underpinning for all wellness journeys. So let's look at a couple of these quotes. Therapeutic alliance is cited by clients and clinicians as one of the most important components of effective therapy. And in multiple studies, therapeutic alliance has been linked to improvement in clinical outcomes. Okay, so how do I link all of this together? If you look at this pie chart to me says an awful lot. If you look at the factors that impact positive treatment outcomes, 40% belong to extra therapy factors. That 40% could be something changed from the time the customer made a phone call to come in to when their appointment was. A situational stressor was decreased. Family relationships improved. We don't know what that is because those are things beyond our treatment control. What we do know is 15% of positive treatment outcome is linked to the treatment modality, the type of approach that I use. 15 out of 100. Then we also know that the customer's expectancy, the belief that they have that this is a person who can help them reach wellness and that they believe that they are going to be able to partner and gain from doing therapy takes another 15%. But look at that, 30% of what works in care is customer-therapist relationship factors. That's huge. That's second below stuff that we have no control over. So that's why I think that relationship, we can show the value of relationship. And relationship is something that happens regardless of what your credentials are, ABC, MD, MS, psychologist. Relationship is foundational to everybody that we connect with. The alphabets don't have a real impact in how you form relationship. And I think that's one of the things that SCF is trying to share very clearly is, regardless of what your training is, that we want folks who are willing to engage in relationship with each other as providers and with our customer owners. So I've defined really a learning circle as a small group of people who come together who share a common interest. And learning circles are different than doing group therapy, and we'll explain how. But a learning circle, just think of it as people who are coming together to share a common interest. It could be coming together to go to a Zumba class. It could be coming together to study or learn about anxiety and how to manage anxiety or get some stress reduction. So our learning circle philosophy is a corporate-wide philosophy. And we have learning circles that are run through our MSD division, through behavioral health division, through organizational development. And each of the learning circles has some core foundation. We expect the facilitators to build relationship. We expect our facilitators to create a safe enough environment where our customer owners feel safe to share their story and their hearts, and our facilitators share their stories and their hearts. That again, we notice the dignity and value of each other, and that the facilitator has a role of both being a participant as well as keeping the group safe and facilitating the group and the content of the group. Alaska Native and American Indian people have oral histories. We are using that tradition of oral history, that way of sharing knowledge and teaching, to be able to connect with our customer owners in a very, very different way. So I think I've mentioned that relationship leads to increased health and wellness. And I just wanted to share something that I had researched here on that point. We know that relationship is foundational, and we're aware that there's a lot of research out there now that shows how important relationship is to physical, spiritual, and emotional health. So I'm going to read this because I want to make sure I get it right. A lack of social ties is linked to depression, anxiety, substance use issues, later life cognitive decline, and increases the risk of premature death from all causes by about 50%. Relationship is such an important human need.
So when we look at our strategy behind learning circles, the key piece to this is exactly what KJ spoke about. It's the Alaska Native people and American Indians have an oral history. That oral history is storytelling. It's a key piece to what we do in our learning circles. It's telling their story. It's listening to their story. But this is so key to the healing for each person that comes into a learning circle. It's to allow them that time, that space, and that we as facilitators need to create that safe environment in which they can share those stories with us and to heal from them. This is learning circles, I said earlier, but they are just another piece of service that we offer here at South Central Foundation. We have taken learning circles as a piece of our behavioral health redesign and formed those out of that, recognizing that not every customer owner needs to be seen by a clinician necessarily, but they just need somebody in that moment in time to sit and to be able to talk and to listen to them. And that's what learning circles can do here at South Central Foundation. What I want to do now is move more into the nuts and bolts of our learning circles themselves and how we formed them and defining what kinds we would have. So when we started learning circles back in 2013, we determined that we could have the walk-in kind, that is like same-day access, and then we would have ones that we knew had to be, me as a customer owner would need a referral from my physician, it could be from my psychiatrist. Those kind are more driven by our behavioral services. So we developed what we called supportive learning circles, educational learning circles, and then we have our clinical learning circles. So in those then, it was determined we would have non-billable, which are more the supportive educational kind, and those are run by what I would call more of the natural helpers, where the billable ones where a referral was needed, those are driven by, again, our behavioral services, and those kind are the DBTs, the MRT learning circles that we offer here. But the supportive learning circles we have, they do exactly that. They give support to the customer owners. Maybe it's a time of grief and loss for them. We're there. We're there to support them through that journey of that loss. Educational ones can be ones where they're coming in and they're learning, they're gaining more knowledge, they're gaining skills maybe. And then the clinical ones, those are more treatment driven with an outcome focus.
What I was going to add is Sandy had mentioned Behavioral Services Division redesign, and I'm just going to give you a tiny background. We had a bottleneck getting people into behavioral health because you have to do a full-blown assessment, which takes a couple hours of provider time and then creating a full report. So that was our bottleneck. So we had a wait list of folks trying to get into behavioral health services. So we did an experiment where we used a very seasoned, experienced clinical associate who was able to see customers on a walk-in basis in behavioral health. And what we found in a pilot was that that person, that contact, almost more than, I'm going to say more than 95% of the customers who had that contact with that clinical associate felt that their needs were met well enough that they did not require a referral into traditional behavioral health care. So what we learned from doing that pilot is when people need someone to talk to and there is someone available who is willing to listen and support, that's a tremendously important opportunity to be able to help. And it can shift then the number of referrals going into other places. So that's what we've capitalized on with these walk-in groups. Customer owner says, I want support in X or Y or Z. They go in and they figure out where that learning circle is on an agenda that we have, and they can go that day. And we've got learning circles that are spread across days and time so that it becomes very easy for people to attend.
So currently at SCF we have over 70 learning circles that are happening at any given time throughout the organization. What's exciting when I look at the different circles that we have, for instance, grief and loss, as sad as it is probably, but it's a very hopeful circle in that we have 6, 8, we've had 12 people come in there at any given time. That one is a supportive type circle. And then you have art therapy over in behavioral services. Men's cultural is another one I've enjoyed watching grow, because when we started back in 2013, there was maybe 1 or 2 men who would come to that circle. Today we're averaging 8 to 10 men who are coming in. They're working with their hands. They're learning about how to make beads out of devil's club, how to carve, all these things, how to make dream catchers that they didn't know how to make, and they're making them with trees. So it's exciting when I look at this and think about the impact we're making through these learning circles. Our attendance also has grown by leaps and bounds. Again, when we started back in 2013, it was focused on more about advertising, getting the word out there to our customer owners. So people were coming, but they were small numbers. Sometimes there might be one person coming to one of our circles, and today every circle has an average of, say, 6 to 8 people at any given time attending. So the numbers have grown. You're looking at over almost 2,000 people have gone through Wellness Matters Night now. And that's our biggest one, and that's the one that, for me, it brings me a lot of joy just watching that on our Thursday nights. But not only have we done learning circles here in Anchorage, but we now do them out in the valley at our Valley Native Primary Care Clinic. So there is a staff of 4 out there who run circles. They also do a lot of the same similar ones that we do here in town, so we're not really reinventing the wheel out there. We use each other's curriculum for those learning circles. And like I said, Wellness Matters Night, that happens both here in Anchorage and in the Valley. We do ours on Thursday night here, and then the Valley does theirs on Tuesday nights. That gives us an opportunity as Learning Circle team here to go out there and help them if they need that added support, and then they can come here and help us, because again, Wellness Matters Night back in 2013, we had maybe 10 people coming. Today, we're averaging over 70 people coming to our Wellness Matters Night. So they get a chance to eat, they look forward to it, they sit and visit with others that they've seen throughout the week maybe, or maybe it's been a week for them, but they get to sit, they eat, enjoy each other's company, it's forming that relationship, and then they go into learning circles for an hour and a half. It's exciting to watch it.
It's wonderful.
So we do customer service feedback, and it is exciting in that, and I don't want to read necessarily the numbers and the percentages there for you, but more importantly, I've captured quotes from our customer owners, and I want you to hear what they're saying, because I think their words speak volumes about what these learning circles are doing. So the quotes are, "I love these circles. This is the most important thing I do every week. I don't want to miss it. I wouldn't have been able to do this without the learning circle. I have learned so much. I appreciate and look forward to it every week. This circle is so different. I can share safely and more deeply. It feels good to get these things out. I don't have anywhere else I feel safe." Can you feel that? They feel safe enough in that circle to go where they want to go and find healing that they've never felt before.
Okay, let's talk a little bit about partnering with the community. So Sandy's just spent time talking about the Wellness Matters Night. Gives you a sense of how word about the learning circles and Wellness Matters Night is spreading. And so we are intentionally partnering with different agencies within our community to help get the word out, but also to be able to serve our customers who are impacted in whatever way. So, for example, we had wellness court judges, 3 wellness court judges come to SCF and talk with us about the need to do moral recognition therapy. That is a 12-step program or a 16-step program that works with folks who are doing a diversion program. So rather than go to jail, they are able to do a type of care or service, and in doing that, reduce the rate of recidivism. It's actually a widely known training that has great efficacy. So the judges came to us and said, it would be really helpful for you to offer this learning circle. We went ahead, we had people trained in the model, and we were able to partner with that, with those judges. And we have a number of women who have come through the MRT Learning Circle and successfully graduated. Now, that may seem like small number and incidental, but when you see how that changes a person's life and the people that person touches and the people that continue to be impacted by a positive change, it actually gets to be really pretty significant. We work with the Office of Children's Services, and we have learning circles that are related to parenting support, toddler time, snuggle time. Toddler time, snuggle time, you know, those are interesting things. Those learning circles, when you get to the heart of it, they're about intentionally bringing a parent or a caregiver together with their toddler or their infant to spend time with them and create that strong attachment. That's the core of it, is the attachment. We also run anger management and life skills. We partner with the Covenant House in Anchorage. That's a homeless shelter for young adults ages up to 20. And then with Beans Cafe. Beans Cafe, we run a learning circle there, and it is the shelter for homeless people who are usually chronically homeless with severe persistent mental illness. And we're able to take a learning circle into that program and just start working and creating relationship and trusting relationship with those customers. Part of the goal there is for them to know of all of the services that are available for them on campus here at SCF. So it's about creating relationship again and bringing people into wellness. All right, let's talk a little about now this idea of learning circles being a corporate-wide strategy. We collect customer owner feedback in many ways at SCF. We have a very large gathering every other year that SCF puts on, and it is a way of showing people what all of our services are. It's a way of meeting our customers and getting their feedback on what would be helpful. So for example, at these gatherings, we've had the Learning Circle team meet with customers and talk about learning circles and what kind of learning circles would they like to see. We always want to be able to have learning circles that meet people's needs. So we have customer owner requests for content in Learning Circle, and we also have provider-driven Learning Circle content. So for example, if you are a clinician working in behavioral health services and you're seeing a lot of folks with anxiety, would be a great opportunity to say, I'm going to do an anxiety learning circle so that I can bring this pool of people together. It's clearly in need, and have them create this small intentional community. We are very deliberate about how learning circles are facilitated. There's always a leader and a co-leader. All of the content of learning circles is vetted by Sandy and I. We want to make sure that the content is community standard, that it has solid support, and that we know if we were to enter into any learning circle on any particular day, what the content would be. That helps us feel comfortable that people are doing the right thing for our customers. We also use that approval process to track our learning circles and to work with our PR department so that we can advertise what's where. So our learning circles are advertised on our intranet for SCF providers and customer owners, and they're all listed on the internet. So at any given time, someone can look up on a day's basis or a week's basis, what are the learning circles going on there, and which one might I want to be interested in? We run these learning circles in lots of different places. One of the things about being from behavioral health is I'm very aware that unfortunately there's still a bit of a stigma for some people to enter into behavioral health, or maybe a bit of apprehension. And when we run a learning circle that's in a talking room in part of our structure, part of our organization, it has a very different feel than going into behavioral health. And that's part of why we do it. It normalizes this idea that we all are human and we all have needs. I'm going to just highlight a couple of learning circles. We're talking about creating learning circles, and Sandy had mentioned one related to grief and loss. Well, that learning circle was very specifically started because we knew a number of people who had been impacted by loss. And so that's why we started it. I also want to share, and I have permission to share this. One of our staff members had a diagnosis of cancer. He went through a certain amount of treatment. He is doing great now. At some point, we talked to him about running a cancer support learning circle. Who better to do that than someone who has faced the fear of cancer, walked that journey, and understands what that's like. He was more than willing. He was delighted to be able to share that experience and help other people. We created really strong content, and the remarkable thing is not only was he willing to facilitate that learning circle and share his story with our customer owners, but his wife, who was also impacted by his cancer, was the co-facilitator of that learning circle. I think that, to me, says a lot about the way we choose to practice at SCF and how important we think knowing each other is. All of our learning circles have a basic format. And if you're a clinician, therapist, you know that this is actually the type of process that happens every hour that you're doing therapy. People are brought into a learning circle. There's usually some type of icebreaker or way of connecting and getting the content going. People enter into story, and as time through the hour gets longer, they are entering more deeply into their story and sharing. And then the facilitator, who is always monitoring time, plus being a participant in the learning circle, brings them what we call up and out. So this is the very basic process of learning circle. Let me give you an example. If I was doing a learning circle related to anxiety, we've got one called Anxiety 101. We might do, the beginning part could be a check-in, and it might be about, what kind of anxiety did you have this week? Or where did you notice you were really struggling this week? People start sharing story about that, enter into what was the hardest piece or what impacted them the most, and here are some tools that they could use in the coming week, and then bringing them up and out. And up and out, when I say that, one of the things that I do when I run a learning circle is ask people, what's your takeaway from today's learning circle? Or, what are you going to consider more over the next week to really anchor some of the education that's being provided?
So for our facilitators that run our learning circles, they have anywhere from high school diplomas on up to master's degrees. So when I look at our supportive type learning circles, those folks there can, and I call them natural helpers, but they're folks who on staff may have a high school diploma. They go through what we call our learning circle facilitators training, which we developed 2-3 years ago now. So people have to go through that if they want to run a learning circle. And then with them, because KJ told you we have 2 facilitators at all times in a learning circle. So if I have that person who has that high school diploma and has gone through the training, there's always another person in there, and that's somebody who's called a learning circle specialist. Those folks have extended experience. They may have that degree behind them. They've gone through the training, and one of the things we look for them to hopefully do is to go through FWWI's Beauty for Ashes training, and then they go through the next layer, which is called their Advanced Leadership and Education training. So those folks have more leading, they understand the process more, and they can be more supportive if something were to happen with one of the participants in that learning circle. And then, of course, you have your clinical billable learning circles where those are run by clinicians. So when we start a learning circle, it's really important for the facilitators to come together to prepare and do their own check-in. Where are they at? Are they in a good place to run that circle or not? So they get a time of sharing together first and then making sure that they have everything ready to go for their circle, which one of the requirements we've put in place is an attendance sign-in sheet so that we can track folks that are coming. And one of the nice things also about that sheet is if we had somebody who did struggle in that circle, the facilitators can come back and give that person a call either that same day or maybe it's the next day just to check in on them and find out where they're at. One of the biggest things that makes our circles that safe place for them to share is called our Learning Circle Agreement. That agreement also came from Family Wellness Warriors Initiative with their Beauty for Ashes trainings, which has been incorporated into core concepts, and now we use it in the learning circles. It's about confidentiality. It's about being on time. It's about providing a safe place for them. So that agreement creates safety for our participants in that circle. So at the beginning of a circle, what we do is we call it a check-in. We do it here at SCF as staff. We do it at our staff meetings, but we check in. We ask them all, check in, where are you at today? How was your week? And then we go into that topic discussion. So if you're following the dip, this is where things start going down because they will start telling story based on that topic. And then to bring them up and out again is, what did you get from that learning circle? What's your takeaway? So that all happens. And then the leaders process afterwards. It's important for them to do that because they're facilitating that circle. And so the focus is not on them, it's on the participants. They need time afterwards to process in case they were triggered by anything that might have been said by one of the participants. Now, if somebody in the circle is really struggling and it's going to take more time for that individual, we have somebody else, another layer of safety for those folks, and that's called care team. And it is important for each person in there to respect each other, whether it's respecting where they are spiritually or emotionally. It's listening to their story, responding from their hearts. And then we, as facilitators, want to keep everybody on subject, because as we all know as human beings, we can go off topic and go on a bunny trail. So those facilitators keep folks on topic, and they keep it safe by starting on time, ending on time. So that's the job of a facilitator, and that's what's in their agreement. Check-ins I told you about. We do check-ins. I do check-ins with my team at any given time, making sure they're okay, because it's my team that is out there on a day-to-day basis running learning circles. So we've incorporated check-ins into those circles. And sometimes that check-in will lead into the discussion of the day. So even though the facilitators may have a topic ready to go, that check-in may drive it a completely different direction for them. And they go with that because, again, They're listening to what the customer owner is saying, and they're going with them. It's not what we want. It's what does our customer owner need at that given time.
So I'd like to pick up on the concept of the care team Sandy mentioned. When we first started thinking very globally about how can we keep learning circles safe, what do we need to do to make sure that it is a service that has value and enhances the wellness of our customer owners, we wanted to ensure layers of safety. So as Sandy said, the first level of safety is the fact that they are co-facilitators. And I'm not talking about the clinical groups, but for those open learning circles, there is always 2 facilitators. And most often, we like to have a male-female. I think it provides a really unique perspective. So the value of having 2 facilitators is really just to confirm that the content of the learning circle is on track and that boundaries between participants and facilitators are always well maintained. The second layer of safety that we have is care team. And it really depends on the type of learning circle that's being run, whether or not that care team are master's level people or whether they are well-seasoned folks without a master's degree. So we have different ways of using care team. For example, at our Wellness Matters night, we are talking about having a master's level person be available throughout that entire night. Because you saw that growth in attendance is just exponential. And we want to make sure that if anything goes sideways or that if a customer needs really significant help, could be an issue of domestic violence or let's say some psychotic behavior, we want to make sure that we've got someone with a skill set who will be able to immediately help that customer owner. So that's our second level of safety for our learning circles. The third level that we have here at South Central Foundation is we've got happily a 24/7 urgent response team. So our customer owners can go to our emergency room and be seen by a trained behavioral health specialist if there's a significant emergent crisis. All right, so let's talk about our data and continuous improvement and what we're doing to try and get some information about the efficacy of learning circles. So what we did when we first started this initiative 2 years ago is we decided that we would have 12 different domains. So with all of these different learning circles, we have something like 80 different learning circles across our campus right now. With all these different domains, the 12 domains, let's take a look at those first. It'll be easier to explain. So domains are substance abuse, anxiety, health, cultural connectedness. I'm going to let you read the rest of that list. But there are different learning circles that would fall into each of those domains. When we do surveys from our customers, they're specific to that domain. So for substance use learning circles, we would want to gather information about whether the learning circle is reducing their use. For healthy relationships, we would want to gather information about how are they coping within, let's say, a family or their job or the larger community. So the surveys that we would give customers are very specific to very specific to the domains. That seemed like a really good idea. So what we were doing for our evaluation is 1 month we would have our facilitators administer a customer satisfaction survey. And the other month they would do this domain survey. So 1 month just rotating all the way through. What we wanted to do was be able to compare someone's survey of a domain at the start of a learning circle and then let's say 4 times into a learning circle or 8 times into a learning circle. That was our goal. So over a year plus, we collected a whole lot of information, some of which we've shared related to customer satisfaction, but also related to these domains. After we had a full year of data, we sat down and we really walked through what is it that we've learned from all of this effort to gather information. We had actually expected the information to show really positive results because early indications suggested that we were way, way on track with what was going. And again, that was from some matched pair data. Here's what we discovered though. Because we are collecting surveys over 12 different domains, the number of matched pairs was really small. And because of the n size, we weren't able to draw really specific conclusions about this is a statistically significant improvement in this domain. So that was a very disappointing outcome for us. And what we are doing now, the decision is, okay, we can't use 12 domains because we're not getting enough matched pairs in all of these domains. We're going to collapse those domains down to one, and it is the global health domain, which gives us a peek into how is someone doing physically, how is someone doing relationally, how is someone doing emotionally. So we also are changing the timeline of the survey administration. First time someone comes into a learning circle, they're going to have a survey administered. And I think if you're following me, you can see where we went off track. If we're doing a domain every other month, someone might have been in a learning circle 3 or 4 times before that first survey was taken. And so we weren't getting how have they changed from the very, very start to where they are now. So we're going to be implementing a different type of survey tool that will be administered right when someone starts, at 4 weeks, at 8 weeks, and then at 12 weeks. And that'll be it. The domain, the global health tool will be used, and then at the end of that we'll be adding information on customer satisfaction. We're going to take a smaller number of questions from what you had seen previously. We're going to use a few of those. We're also going to add a question around spirituality, cultural connectedness, and then their rating of their group facilitators. So we're going to collect good information. And we believe that that approach is going to give us the number of matched pairs that we need to say we're showing some pretty good stuff. I'll share with you right now a little bit of the information that we gathered. So we had 5 matched pairs, and this is from the Promise Global Health domain. We had 5 matched pairs with an early baseline, people who had attended at least 4 learning circles. This is what we were seeing. And again, not statistically significant because of the tremendously small n size. But for what we were able to gather, and just this little peek, global physical health measure increased by about 12%, global mental health measure increased by 10%, social health measure increased about 3%, and the overall health measure up 14%. So for us, we think that those are very, very promising results, and what we need to do is to be able to demonstrate through data what the comments and quotes of our customer owners are saying to us. That's the absolute goal where we're at right now in terms of data collection. We know that these learning circles work, and we're going to be able to have real hard information to show that this is a very, very good way of serving customer owners. So we've given you an awful lot of information related to our learning circles, and Gil, I guess I would like to ask, is there anything that we haven't covered or that you'd just like to touch base on?
Sure. One thing I did not mention when I introduced myself is that in my current role I work in our Learning and Development Center, which allows me an opportunity to work with KJ and Sandy and with some of the other folks that work here in helping to create content and curriculum. And one of the things we're always looking at doing is aligning any content and curriculum which we create for our employees with those same core concepts and the mission and vision of SCF. So the things that we think are important to apply to learning circles for our customer owners are the same things that we think are important to apply to the learning and development of our employees. And so that is something that I think is a way that we try to align this even further. Again, we talk about this being a corporate-wide push. That's another way in which we are doing that. Also, before I started the role that I'm in now as a clinical advisor in our Learning and Development Center, I worked as a clinician as well in our primary care clinics, behavioral health consultant, for about 12 years. And the availability of learning circles for me to refer customer owners to was huge. The ability to tell people that, hey, there's this specific issue you're dealing with, depression, anxiety, grief and loss, whatever it might be, there was a learning circle for almost all of those things that we could make those connections to. And for most of those were things that people didn't necessarily need a referral to. They were able to attend when and if they so chose. So the availability of learning circles as a resource for our customer owners has broad impact. And I think that we were just looking at data related to this. I think that as we continue to grow and develop this idea and really refine learning circles, we're going to see that impact grow more and more. And I'm excited to see where learning circles are going to be in a year from now, 5 years from now, 10 years from now. It's just a really exciting thing to be a part of.
You know, you reminded me, at our last NUCA conference, which is a big conference that we do annually, we had a provider panel. We had a customer owner panel and a moderator, and the customer owners were talking about the care that they receive here at South Central Foundation and what they valued. And out of the 4 people who were on that panel, 3 of them were attending learning circles and spoke specifically to the value of those learning circles. And for me and Sandy, as people who are really passionate about this, that was a very, very proud moment.
We want to thank you again for joining us today. We hope that our presentation today has given you some information that's going to be useful to you and to your organization as you look at implementing and developing learning circles to meet the needs of the community that you serve. It's a really flexible tool that can be adapted to provide a variety of approaches to enhancing wellness and growth for customer owners or clients or patients, whatever the folks you serve are called within your system. And you could forward to the next slide.
Certainly.
KJ, thank you. If you'd like more information about learning circles or about anything related to the NUCA system of care, we encourage you to reach out to us. You can reach us by contacting the Learning Institute here at South Central Foundation. By phone, you can reach us at 907-729-6852. Again, that's 907-729-6852. Or by emailing us at scflearninginstitute@scf.cc. On behalf of Sandy, KJ, and all of us here at South Central Foundation, thank you again for joining us. We hope you'll join us again another time.
Thank you.
Thank you.